So Heartland's mission and vision is certainly centered around changing the lives of children and families. And truly what that's about is having the privilege and the opportunity to be a part of a child's life.
I think the opportunity to get to work with kids in and of itself is special to me, and that makes Heartland unique.
We truly wrap each kid up for who they are as an individual. We get to know the kid, truly know them, and we have fun.
What we're very fortunate to have is a space that is for children only, and I'm very grateful for that because we really get to be a place for children to come and play, to be provided high quality care. We also get to provide them with a place that is not just a hospital, it's the hospital. It's a place where they can go outside. It's a place where they can play. It's a place where they can heal.
We have an outpatient clinic which serves families virtually and in person in our rural community. We have our acute care program, which is usually about 5 to 7 days, and that's meeting the initial immediate crisis. We also have our residential program, which is anywhere from a few weeks to a few months, and that's where we go in deeper. We take a look at what is causing us to go from hospital to hospital, what's keeping us from going home, what can we do together to help you get there and stay there.
We see patients anywhere from the age of 4 to 17, do medication management, also help with resources in the community as far as therapy services, community outreach support services as well. Typically, our patients will maybe be struggling with school, ADHD symptoms, depression, anxiety, a lot of things that our kids struggle with from the school age standpoint, and be able to help them.
We have our DBT program. We also have ITCT, which is Integrated Treatment of Complex Trauma. With ITCT, we are helping children who have had significant trauma, complex trauma, chronic, ongoing, and helping them figure out how to live their best life.
I think there's a lot of things that make Heartland unique. Obviously, our equine center is the number one thing that comes to mind. We got our splash pad. We keep the kids engaged and involved. Just treating the kids like kids and giving them the respect that they deserve. So
we have multiple expressive therapy rooms, one that's focused on music and movement and sand tray and play, and then we have another one that's focused on art and expression. And then of course we have our outside amenities and our gym. So when it's cold and rainy and yucky, we can go into the gym, which was just recently renovated, and the kids can play and they can enjoy being children and they can move and they can kind of sense the fact that their bodies are releasing some of the things, the trauma and the pain that they're feeling.
We had a girl who we tried multiple ways to build connection with her, to get her to buy into the program. One day I'm coming back from break and I see her out at horses and just doing normal kid things, which wasn't really like her. Later on I found out she had made a really big connection with one of the horses. For her, that kind of started her progress in treatment.
we had a kid discharged not too long ago, and before she left, she said to me, "If you ever thought you weren't somebody's hero, you were mine." And so I think something like that kind of sticks with you for a while, forever. And that's why I do what I do.
All of those hands on the wall represent kids that have strength, kids that have fought, kids that haven't had a fair chance at life, and that is strength.
The handprints mean that child mattered, and that child knew that they mattered. Those handprints were one of the things that I started, I think, in 2011. And I thought to myself, how can we recognize these children and the work that our staff do every day? And so I had this idea of them leaving their mark. They leave us their handprint when they are finished with their treatment and when they are moving on. And on that wall, it says, "My life has changed." And to me, that's so important, that they recognize that their lives have changed, whether it's small amounts of change or really big amounts of change. But them leaving their handprint here for us to see forever is incredible. It reminds me every day. I walk past those handprints every single day as I climb to my office, and I make sure that that's my mission, that that's my vision.
When I walk through the hallways and I see the handprints, and I remember like the first handprint that went in the hallway at the front entrance. And then I walk through all of the hospital and I see all of these handprints where it was something that was going, I think it started out to be something just kind of small, and it turned into hundreds of children that have been able to be touched. And it helps, I think, sometimes also maybe just remind us that we're here for a purpose, and these little people we've been able to help.
I love the transformative process that kids go through while they're here. I've seen kids start off saying, nobody's ever going to love me. I'm just going to go from placement to placement to placement to going home.
I believe in Heartland. I take a lot of pride in what we do here. I believe that what we do here works. Overall, being able to see some of these kids come in with true struggles and seeing their progress and growth, whether it be they have one day of safe behavior, whether it be 1 week or a month of safe behavior, and we're able to help plant those seeds for them to be able to leave here and continue growing and being safe and just living their lives.
Literally, this building has been taking care of children for over 100 years. In the late 1800s as an orphanage and a convent, and became a boys and girls home and school in 1917. So it's really been a pillar of our community and just been a really beautiful place for children to come for many, many years.